Proton pump inhibitors. The main regulator of acid secretion in gastric parietal cells is hydrogen-potassium ATPase pump, more commonly known as proton pump. Hydrogen-potassium ATPase enzyme system pumps the proton from parietal cells into the gastric lumen, interchanged with potassium ions, which are transported into parietal cells. Therefore, proton pumps are the main acidifying factor of gastric fluids. Different groups have been developed to diminish gastric acid secretions. Binding of gastrin molecules to their receptors initiates cascades of reactions that result in the activation of proton pumps. Thus, gastrin increases gastric acid secretion. Similarly, acetylcholine enhances the activity of proton pumps. Thus, stimulation of cholinergic receptors increases the acidity of gastric lumen. Binding of histamine 2 molecules to their G-coupled receptors results in the activation of adenylyl cyclase enzyme. The active enzyme, in turn, increases the activity of protein kinase A enzyme, which enhances the proton pump function. As expected, blocking of histamine 2 receptors will reduce proton pump activity and acid secretion. Histamine 2 blockers include ranitidine and famotidine. Conversely, prostaglandin E2 molecules inactivate the adenylyl cyclase enzyme. Thus, it decreases the proton pump activity and gastric acid secretion. The main example of prostaglandin agonist is misoprostol. Logically, direct closure of proton pumps will significantly decrease the gastric acid secretion. In fact, proton pump inhibitors group is the most effective suppressor of gastric acid secretion. Proton pump inhibitors include omeprazole and esomeprazole.